Meeting in progress. Testing clerk's laptop.
Yes.
Testing clerk's laptop. 3.
I've just muted Irene. Oh, I just hit the city's website and I could hear you.
Okay.
Yeah, I've heard you.
Testing.
Okay, so I will stop my recording.
No, hold on. Testing clerk's laptop. What happened?
One-ish. And we begin at 1:30. However long he needs to. I just heard myself, which is horrifying.
On where? Yeah. Testing. Are you hearing? Testing.
I heard testing clerk's laptop.
A second on. Okay, great.
I'm going to stop.
Yeah.
Hi, hang on, folks. So you're going to get muted. We're going to go live, and then we're going to get started. So everyone's on mute.
We are streaming and recording.
So welcome to the Board of Health meeting of this June the 16th. Last time we met was sometime in February. So welcome back. And I'm going to indicate that the meeting is now live. And good afternoon to everyone. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on our city's website. And a reminder that all electronic devices are to be switched to a non-audible function during this meeting. I'll now go to roll call. So I'll call for those that are present. Councillor Wilson, you're present.
Present.
Thank you. Councillor Farr. Thank you. I see you. Councillor Nan. I see you as well. Thank you. Councillor Marula as well. Councillor Collins, I see as well. Councillor Jackson, present. Councillor Pauls, present as well. Councillor Danko, I've seen. Yes, there he is, present. Councillor Clark, present. Councillor Pearson, present. Thank you. Didn't see you in that maze there. Councillor Johnson, present as well. Councillor Ferguson, thank you. Councillor Vanderbeek, not yet. Councillor Whitehead, I haven't seen. Sorry? Councillor Vanderbeek is there. Thank you. Councillor Whitehead, not yet. And Councillor Partridge, I've seen as well. Marked as present. Thank you. And can I please, Madam Clerk, have any changes to the agenda?
Hi, Mr. Mayor. We have one additional piece of correspondence from Dr. Nicola Mercer, Medical Officer of Health, respecting the issue of an order under Section 22 of Health Protection and Promotion Act to ensure public safety, and the recommendation for that correspondence is to be received.
Okay, thank you. I have a motion to approve the agenda as amended then, moved by Councillor Pearson, second by Councillor Ferguson. All in favor or opposed? Electronic vote. Whoop. What happened? Councillor Pearson and Councillor Ferguson. Moved. And any comments or questions? If not, to the vote. Oops. Whoop. Sorry, this is my mess up here. Here we go. Sorry, I got it. Councillor Pauls, you're in favor? Oh, shoot. Councillor Pauls? Yep. Okay. Thumbs up, Councillor Pauls. Thank you. Councillor Partridge is waving to speak. So you want to turn Councillor Partridge on? Go ahead.
Yeah. I had a weird voting in progress come up on the screen, and my name's not on it and allow me to vote. So
Okay.
I'm in favor, obviously, but I just want to make you aware of that.
All right, we'll take that in favor, and then hopefully that'll be corrected next time we vote, if we vote. Thank you. Okay, what's the problem? Are we good?
We can move on, yes.
All right, that's great. So the agenda is approved. Any declaration of interest? Anyone have any declarations? Please indicate. If not,
Do I have to activate the speakers list for that?
do we see any declarations? Okay, so I'm going to turn to the approval of the minutes of February the 21st, 2020, last time we met. Minutes are before you. Could I have a motion to approve? Moved by Farr, seconded by Vanderbeek. Any questions or comments? Thank you. So it's moved by Farr, seconded by Vanderbeek on the minutes of 2020, February 21st. We'll go to a vote. I see no comments or speakers. All in favor? Oh, I'll wait for you. Okay, I got to switch back and forth. That's why I use two laptops, actually. Anyway, it's all good. Councillor Pauls, you're in favor? Yep, thumbs up. Thank you. All right, we're going to go to communication. Items 5.1 through to 5.5.
Mayor, Mr.
Councillor
Mayor.
Partridge couldn't vote again?
No, it's still
No?
doing the same thing. So
Okay.
if you could just
thumbs up.
remember to come to me and I'll indicate. I don't know
Just
why
give
it's
me
doing
just
this.
give me the thumbs up unless you're
Yep.
unless you're opposed. We'll include you as favor. Thank you.
Yep. Thank you.
Thank you. I'm back to communications and items 5.1 through to 5.5. There are 5 items. They all have recommendations. Any comments or questions on any of those? Okay, Councillor Wilson, I see, and Councillor Nand. So Councillor Wilson, go ahead.
Thank you, Mr. Mayor. Just to note procedurally or technology, in terms of technology, the request to speak was not working. I just wanted to inquire about the recommendation that is set out in Communication 5.2. This is the Simcoe Muskoka Health Unit calling for basic income during COVID, but also permanently thereafter. And the recommendation is that it be endorsed. And I'm just seeking clarification whether this council is on record endorsing basic income. Because I don't know.
Yes, and you know what? And we did deal with that at the agenda review, and I have to be honest, I forgot to double check on that. I think we still have to do that. My belief is that we endorsed the pilot program full stop as a council, which de facto is an endorsement of the basic guaranteed basic income, but it may not be, it was part of the pilot, so we may need to reaffirm the guaranteed basic income as a standing policy going forward. So I see no harm in doing that.
No, that's great, Mr. Mayor. Thank you. Obviously, I support the action, the recommendation to be endorsed, but I just wanted to make sure because the item is a little truncated. It says respecting basic income during COVID, but the actual letter, when you read it, is during COVID and permanently thereafter. And that's why I was seeking clarification whether that was something we had already done or we need to do formally. And if we're endorsing this communication, then I guess that is our formal endorsement. Thank you.
Correct. Thank you. Councillor Nunn?
Thank you. Thank you through the mayor. Similarly for 5.1 and 5.2, in a quick scan and just getting a sense of where this board or council had previously stood on these issues, I was also curious about procedurally endorsing versus this board also issuing statements similarly.
Okay, and I don't have an answer on number 1, so we just dealt with 5.2, and I think the endorsement of that, I think, would be, a follow-through. But on 5.1, has the public health endorsed food affordability and food insecurity?
Particularly for this one, it's around the data collection, the fact that the Canadian Community Health Survey has information around food insecurity data, and that data might be useful for our Board of Health here locally as we're planning and putting in the interventions needed locally.
Yeah, so let me talk to him. Let me turn to Dr. Richardson in terms of data collection, which has been a topic through this COVID process. So, Dr. Richardson?
Thank you, Mr. Mayor. Can you hear me?
Yeah.
Okay, great. Just wanted to address there's sort of 2 different elements. One is the nutritious food basket, which is an important piece that we do, and we use the protocols that have been set out in order to do that. And then there's this piece endorsing including data on local household food insecurity in the Canadian Community Health Survey. So I'm not sure that we've seen this one before as a module. Certainly, it would be releasing this specific set of data that would be asked for, and I don't believe we've had any position on that.
Okay.
Okay, thank you. Councillor Nan?
Thank you. So I'm fine with the recommendation as is to endorse it.
Okay, thank you. Any other comments or questions on communications? So a motion on communications, sorry, is there a speaker? Nope, okay. A mover on the communications, moved by Collins, seconded by Partridge. All in favor? Sorry? Right. Well, we'll see how the vote pans out, and so. Okay. Councillor Ferguson, you're in favor. I don't think we saw your vote come up, or did it come up for you? Okay. Great, thank you. And that finishes communications. We're going to turn to item 7.1, year-end public health service performance report. Dr. Richardson, if you would.
Thanks, Mr. Mayor. It's a little bit of time has passed since we put all of this together. This was completed for the end of 2019, as you know from the report. And essentially what has been going on up until COVID times was that the province has been looking at performance measures, and we have been developing a performance tracking system within public health services. And so this was our own internal report to the board, summarizing where we were at in both moving forward on our priorities, which are outlined in more detail through the report around mental health and addictions in particular, but also healthy weights and health equity. And of course, those remain our priorities within 2020. And actually, we're going to come back and talk about those a little bit more in a few minutes. Also appended, though, is a more detailed listing of other relevant targets that we set out. So you have a fairly lengthy number of statistics and whatnot to go through. There's not a lot of change in terms of what we've seen, and generally we're making very good progress both within the priority areas and across all of our programs and services. So nothing in particular to note that was a challenge at that point. Of course, we will be talking a little bit more about how we go forward in 2020 in just a few minutes.
Okay, thank you. Councillor Jackson.
Thanks, Mr. Mayor. Thanks, Dr. Richardson. I just have, Mr. Mayor, about a half a dozen quick questions of subjects of interest for me here. On page 4 of Appendix A, Dr. Richardson, I'll just go through these chronologically according to the low to high number paged sheets. On item 23, the treatment of sexually transmitted, well, they used to be called diseases, STDs. They're now sexually transmitted infections, STIs. I noticed target unmet. Public Health Services continues to promote use of first-line treatment by physicians and clients. Mr. Mayor, through to Dr. Richardson, maybe a comment on that. And Dr. Richardson, is this part of the program primarily geared towards young girls during the teen years and the Worth the Wait campaign, or is this across the board in terms of gonorrhea and other STIs? Through you, Mr. Mayor, please.
Thank you. Dr. Richardson.
Thank you, Mr. Mayor. This particular indicator, it's a bit of a misnomer to call it a performance indicator for public health, because in this case, it's actually what the physicians use to treat all cases of gonorrhea. So this is not specific to the age group that you mentioned, Councillor. Okay. It's all cases of gonorrhea in whichever gender or age group that they come to us in. And so it is our job to promote appropriate use of guideline therapy to our colleagues within the healthcare system, but ultimately it is they who make the choice along with their patients around what treatment to use.
Okay, thank you, Dr. Richardson, for explaining and clarifying. Page 7, Mr. Mayor, of Appendix A. The item 38 at the top, I want to congratulate you, Doctor. Percentage of injury prevention according to the age-friendly plan that the city adopted, Mr. Mayor, 2014. Recommendations completed with partners in the age-friendly collaborative governance committee and its working groups, the Council on Aging, wonderful partner. Maybe just a comment in terms of my accuracy of my interpretation of this, Dr. Richardson, please.
I might turn on through you, Mr. Mayor, turn to Kevin McDonald. I believe he's on the WebEx.
Thanks very much, Elizabeth, and the chair. Yes, in terms of the collaborative work that was identified with community partners, Councillor, looking at our ongoing metric for that, that was met for the subsequent year. Work in that area continues with those respective partners, albeit suspended for the time being, given the pandemic emergency.
Thank you, Director McDonald. Okay, terrific. So on that same page, Dr. Richardson, Mr. Mayor, item 40, percentage of vapor product retailers in compliance. We all know it's a new legislation. It looks pretty good in terms of last year's total of 95% compliance. Technically, Doctor, you put down target unmet. And I just wonder, maybe through you or Director McDonald, who I know was immersed in this issue, just wondered how things are still proceeding in our community in this new area of public health and concern, especially for our youth with vapor products. Through you, Mr. Mayor.
Thank you.
Through you, Mr. Mayor, I'll turn to Kevin McDonald again on this one.
Okay. Kevin.
Through you, Mr. Mayor, and thank you, Councillor, for the question. For the most part, during the last several weeks, we've been responding on a complaint basis only. Our capacity has been significantly diminished given the redeployment to the COVID-19 emergency. Certainly, that percentage, we're very pleased with what we're seeing in terms of overall retailer compliance. As the notation indicates, given that it's new legislation and there are some to it, we're working with retailers to move towards compliance. Where we see chronic issues of non-compliance with direction, et cetera, then we would move to a more progressive enforcement model. We have received correspondence just this past week from the Ministry of Health regarding some further developments on this particular legislation and file, and we'll be looking at those in short order in the coming weeks.
Thank you. Okay.
Thank you, Director. Terrific. So sounds like we'll be ramping it up as we start going through the stages 2 and 3 and in terms of getting out of hopefully COVID. So that's great, Director. Thank you. And lastly, Mr. Mayor, page 8, please. Items 46 and 49, Mr. Mayor, Dr. Richardson, the Dental Health Services Program, the bus. Obviously very proud of this Board of Health this term, unanimously supporting this wonderful program, especially for the seniors and those that need oral health and can't afford it. I'm a little dismayed, unless I'm misinterpreting Dr. Richardson, item 46, by year's end, only 14% target met, and under item 49, only about 26%. Now, mind you, you talk about a record number of people, over 2,000 in 2019, with the bus operating 5 days a week that you served, but still room for improvement there under item 46. And under item 49, changes to the approach are being investigated to hopefully increase preventative services as well to those, especially in their later years, that need this oral health and this dental bus. So, Doctor, maybe just a comment as to maybe why the targets aren't unmet and how we're going to hopefully improve to capture more of the seniors across the city. Through you, Mr. Mayor, and those are my questions.
Thank you.
Through you, Mr. Mayor. So these particular set of measures relate to all adults, not only seniors. And as you know, our seniors dental program is just in the midst of rolling out in a broader fashion. Of course, it's been somewhat delayed due to COVID-19. And we do know, and unfortunately, this is one of those where we'd love to serve as many people as we can, but we'd love there not to be a need to serve people through this route because this is a low-income dental program, and wish that everybody had the resources to access the services of their choice as they need. I'm going to turn to Jen Vickers-Manson, who's also on the call, to just give us an update about those specific issues and where we're at with Ontario Seniors Dental Program implementation.
Thank you, Doctor.
Hi there. Thank you, Elizabeth, and through Mr. Mayor to you, Councillor, in regards to your question. So just noting that there are some opportunities for improvement. We do see variations in length of appointments on our dental bus in terms of time for service. And we see some opportunities for efficiencies in booking in our afternoon slots. So as you know, our bus is in different locations in the city 5 days a week, and those are drop-in visits currently. And sometimes what happens is folks who aren't seen in a short amount of time leave and they don't return. And so that accounts, those numbers have been captured in the turnaway at point of care. So there's just an opportunity for us to refine how we're capturing that information, as well as looking at booking appointments in the afternoon so we can tell folks exactly when they can come back.
And Director, Mr. Mayor, just to wrap up, Director Vickers-Manson. So again, I remember months ago, pre-COVID, we asked about how this wonderful program, both the general bus and the new bus program for seniors primarily, how we were going to communicate and promote that. And in light of the numbers that we're not reaching or not reappointing, just wondering how that campaign's going. Thank you, Mr. Mayor.
Okay, thank you.
Through you, Mr. Mayor, to the councillor, thank you again for your question. We have done some media and print advertising. I will say that with the redeployment to COVID-19 emergency, that is something that we will have to reinitiate and remind people of the program as we bring our programs back on.
Thank you.
Okay. I'll wait for that further down the road, Mr. Mayor, as we get through COVID. Thank you, Mr. Mayor. Thank you, Doctor.
Thank you. Thank you very much. And we are adopting the 5-minute rule today. So Councillor Wilson, you're next.
Thank you, Mr. Mayor. I'm particularly interested, again, on Appendix A, items 9, 10, and 11, 12, 13, and 14. This is primarily focused on maternal health and babies. I was just wondering if Dr. Richardson or the appropriate public health staff could just give me a sense of, on P11, the target of 15% for the percentage of pregnant women screened for high risk. In my mind, that seems to be an awfully low target, and I was just wondering what's the rationale behind that particular number? Through
Doctor?
you.
Through you, Mr. Mayor, I'll turn this over to Jen once more.
Okay.
Thank you, through the chair, to the councillor. I'm just looking at this percentage of pregnant women screened for high risk who are offered a home visit. So these are our folks that are screened and then offered a high visit. And this, just to remind folks, is of our entire birth cohort every year, the population being about 5,500. So in terms of a target, we have really moved. This is actually a good news story, and maybe I'll just take a step back and explain this a little bit differently. The province sets a target for screening women postpartum, and we are traditionally very high in that area, and we do our screening in the hospital mostly before folks go home. Our target, we have two other areas for screening using the same screen. One is in the prenatal period, and one is in the early years. So recognizing that these are the same families screened at different points in time, we really set our target on increasing our screening for pregnant women and capturing people as early as possible during their journey to parenthood. When we started this journey in about 2017, we were screening prenatally at a rate of about 3%.
Mm.
And so over the last couple of years, we have significantly increased the rate of screening we're doing in the pregnant population. And we have piloted placing our public health nurses into prenatal clinics, one at St. Joe's Hospital and one at HHSC. And we continue to monitor this metric in collaboration with our hospital and primary care partners to see how we can continuously improve. So it's actually quite a good news story, and I appreciate your question.
Thank you.
You're welcome. Could you help me elaborate then on P13, the percentage of clients who stop participating in the nurse-family partnership? And I'm looking under the comments section. Attrition reasons include loss of contact, refused program, moved. I'm wondering if there's any insight to be had on the relationship with or a lack of stable housing. Is when it talks about moving and loss of contact, is that a factor? Can I read that into that or not, Jen? Or to whom?
Jennifer,
Yes.
is there a reason why you don't have your video on, Jen?
Do you want to see me? Let me just.
I think we want to see who we're talking to. I think I noticed that all staff haven't turned their videos on. So.
And I'm going to be the first one to do it, Mr. Mayor.
Oh well, you're a brave soul. Unless you're having a bad hair day, but I doubt it.
Well, I will save comments. Hello, everybody.
Looking fine. Thank you.
So through the chair to the counselor, again, it's another great question. It's great to see you paying attention to these important metrics. And I'm just trying to pull that up again so I can remind myself exactly the metric we were looking at.
P13, Jen.
Oh, our NFP. So that is specifically our nurse family partnership program. So just to remind folks, these are our pregnant youth who are 21 years of age and younger. And they are very vulnerable youth who are, as you've indicated, quite mobile and quite high risk. And although those attrition rates are high, they're actually quite good, what we're seeing in Hamilton relative to other areas, and quite comparable to NFP across the globe. And so you are in fact quite right. Some of these young girls move out of our area, and also some do struggle with stable housing.
Yeah, I'm just interested. Thank you so much for that. I'm interested in the overlapping of needs and what causes what, and the importance of stable, secure, safe shelter, and how much that is a platform for so many other health-related factors. And in the absence of that kind of stable, safe shelter, we're potentially setting up or are setting up, in all likelihood, another generation of children who will not be able to, have access to the same sort of health outcomes that public health calls on us to give them. So thank you. Those are my questions.
Okay, thank you. I was just going to mention the 5 minutes, but you're well within that. Thank you. Councillor Nat.
Thank you. Through the mayor to staff also on Appendix A. So just to give a heads up, it'll be P6, P35, and P37. So P6 speaks to air quality indicators, and our current target is set at 20% in terms of our Air Quality Task Force Action Plan 2019. And the comments say the target's met, but the target was based on the complexity of milestones. And I was wondering if there was staff who'd be available to just help break that down. One, if our target is set at 20%, just help us understand why, and if there is any comments on the complexity of the milestones, please.
Okay, Jennifer, unless you're answering, you can unscreen yourself if you like, but you can stay there as well. Doctor, anyone you want to direct this to?
Through you, Mr. Mayor, let's ask Kevin McDonald for this one.
Okay.
So thank you very much, and through you, Mr. Mayor, thank you very much, Councillor. Unfortunately, I don't have the details from Trevor Imhoff before me, but if memory serves, Many of these milestones were over multiple years, so it was also looking at the sequencing of these as we move through and progress through 2019, but also some of the interplay with the provincial government as it related to some of these milestones in terms of could we move the yardstick pursuant to some of the provincial regulation as well. So I'm more than happy to follow up and have Trevor connect with you to provide a more detailed summary of those milestones.
Thank you.
Appreciated. Thank you. And thank you to yourself and Trevor for all the work in the last year on this issue and interfacing with my office around the concerns around air quality, particularly in the North End, but also throughout the city as well. In terms of P3, this is speaking to, sorry, I'm just toggling between screens. P35, I believe, was the naloxone kit distribution, and the numbers are looking good, generally speaking. So we hit it. We set a target of 40% kit provision, I guess, through our stakeholders, external stakeholders, and we've exceeded it. Is that correct? Am I misreading that? And the target was set at 40%, and at the end of 2019, it says 41.9.
So perhaps through you, Mr. Mayor, the issue of providing naloxone has been sort of different pre-COVID as well as post-COVID. So essentially what we were trying to do here was to get as many external stakeholders as possible being able to provide naloxone and working with them through model policies and agreements and whatnot to get the number up. And we got to the target that we met. But I'm going to ask Michelle to give a little bit more detail because it has been a bit tricky. We've seen decreases in actual naloxone provision, but increases actually in the number of stakeholders. So Michelle, perhaps you can provide a little more detail.
Thank you. Michelle? Are we there? Not there?
She was there.
Sam, your audio is coming off and on, I think.
Oh, it's my
Michelle.
video and audio, actually.
Okay. You're on now, yeah.
Okay, I'll try again.
There you are. Thank
there
you,
we
Michelle.
are. Now we can.
Through you, Mr. Mayor, to the councillor. Yes, so for this particular metric, I would say for 2019, we worked quite diligently to work with our stakeholders.
Is my audio on?
Yes. Sorry, Michelle. Thank you. Yeah. Can you?
Okay.
Okay, we'll get you from here, Councillor. Thank you. Okay, Michelle, back to you.
Thanks. So yes, so working with stakeholders, of course, these are our partner agencies in the community who do have broad reach and the ability to reach out to our clients, of course. So we were onboarding our partners to distribute naloxone in the community, which moved along quite well. I would say in 2020, through COVID, we've been having a bit of a different experience in that we've certainly been striving to increase our own naloxone distribution. But as you know, some of our partner agencies aren't working in the same way they were previously. Like all of us, they've changed some of their business models, and as a result, we have been challenged in finding ways to get naloxone into the hands of our clients, but we're certainly working to try to address that. And
could you lift your microphone there a bit, Michelle, so we can hear you a little bit clearer? Yeah.
So hopefully, as we move forward in 2020 and stakeholders and our partners begin to open up again, we'll be able to increase the distribution once again. But right now, we are trying to increase our own distribution.
Excellent, thank you. And then Michelle, I guess through you, Mr. Mayor, to Michelle, P37, in terms of our percentage of needle distribution that are returned to the harm reduction program. So seeing the numbers and again, understanding that the year-end totals may be impacted by the same circumstances in terms of getting reporting back from our community partners, but that big spike from 33% to 63% and nearly a 30% uptake, does that correlate with the installation of our community disposal bins?
Yes. So through you, Mr. Mayor, on this particular question, yes, that does correlate with our disposal bins, although we do see fluctuation on this one over an annual basis, basically very much dependent on when needles are coming in, because certainly at lots of times we're giving out needles and not necessarily are we receiving them back. And our partners report to us on a routine basis, but not as they receive needles. So it tends to be at the end of the year. We see a little bit of spike annually, but this did correlate with their installation of bins. And on that point, I will say that we've also had increasing requests for additional bins. And once we get through this COVID work, hopefully we'll be able to onboard some more bins within the community.
Okay.
Excellent. Thank you,
Thank
Michelle.
you.
I think that those correlations are really telling. And, you know, as more people are requesting, and once we get back into operations that enable that, I think we'll continue to see those numbers go up. So thank you very much.
No problem.
Okay, thank you. Councillor Clark.
Thank you, Mr. Mayor. So my questions are about items number 21 and 22. And my questions would be to, I think, Dr. Richardson, but I'll leave it to you, sir.
Mm-hmm.
So this is with regards to the long-term care facility outbreaks, and I was trying to understand the explanation as to why there was, I guess first I need to understand the definition of the duration of an outbreak for both 21 and 2022, or is it the same definition?
Doctor?
Through you, Mr. Mayor, these are ones we are challenged with too, based on trying to define it clearly. So trying to look at outbreaks that are happening in long-term care homes, and these are, of course, have nothing to do with COVID in terms of the ones we're talking about them, and looking at how many of them had a long duration. In other words, how many didn't come under control quickly. Part of the challenge is that the viruses themselves sometimes have a longer incubation period, which, if there is spread, can make things take longer. So we're trying. It's really more of what we would call a monitoring indicator. It's not so much a performance one, but it's one that we've wanted to look at and see, can we get outbreak control to be much tighter as we go forward. So the number of the denominator in each of them is the number of homes in outbreak, as I recall, and the numerator is the number who had a longer than sort of more than average, but a higher range of duration. So does that help, Councillor Clark? If not, maybe Michelle can take a crack at it. She may have an even better way of framing it.
Okay, Michelle, do you want to?
Okay, through you, Mr. Mayor. With respect to, yes, Elizabeth described that correctly. On the first one, we're speaking to respiratory outbreaks, the second to GI outbreaks. Basically, what we're looking for in this, it's really for us to determine whether or not good infection control practices are in place. One of the ways we measure that is to see how long that outbreak goes on. So we'd want to see them within sort of average, and what that is really based on the type of agent at play, but we want to see outbreaks not drag on longer than needed. Two things. First of all, certainly it impacts the residents' well-being at the facility, and then of course speaks to us with respect to how well the control measures are in place. So these are a bit of monitoring metrics to us, and I would say we're trying to tighten these up and get the right metric in place.
Thank you. Councillor Clark.
Thank you. So on item 21, 21.4% is a doubling between the first quarter to the last quarter. Was COVID starting to play any role in that? We're hearing lots of discussions in the US that COVID could have been in the United States in November and December. Have we heard anything along those lines?
No. So through you, Mr. Mayor, this particular one really plays into the seasonality of what viruses are active in our community. So you'll see in Q1, Q2, I mean, I don't see the numbers in front of me, but I would say that those ones are more likely influenza outbreaks. So that's what we're kind of seeing at that time of year. We have a very good control measure in that we use prophylaxis with Tamiflu, both to prevent cases and treat influenza cases in long-term care and retirement homes. So those outbreaks tend to be shorter in length versus we might see something like metapneumovirus, parainfluenza circulating in the sort of that Q3, Q4 in the early fall. And those, because there is no treatment or prophylaxis available, tend to last a little longer.
I understand. Thank you. And so then the last question, and I'm not sure whether or not this is in order, so I'll leave it to you, Chair. So with respect to these numbers here, the parameters that we are measuring on an annual basis, on a go-forward basis, and what we have learned from COVID-19, will there be changes in guidelines and policies and protocol from public health to long-term care facilities and residential care facilities and retirement homes in terms of how they protect the residents and protect themselves from contamination?
Mm.
Michelle, do you want to
Mr.
try
Mayor.
that one?
Sure.
Let me,
Through you. Oh,
Michelle,
Okay,
why don't I
go ahead.
start this one off?
Okay.
Through you, Mr. Mayor, this is, of course, a subject that is very of great interest to everybody, essentially, in coming out of COVID-19. Is how will we manage things going forward? And so, there are a number of different groups who are looking at, how we're going to do things, and everything from a commission, of course, that's looking into long-term care. There's going to be an audit by the Auditor General around pandemic preparedness and management. There's going to be many, many people who are reviewing, looking at, weighing in on how we go forward. For us, in terms of how what's required in terms of infection control, I think it's still the same first principles that have applied throughout in terms of that hierarchy of controls. You remember Paul talking about, and I talked about when we presented, and what you do in order to reduce transmission. And then ideally you do have vaccines and you have treatments that are available, but COVID-19, of course, is not one of those that we can do that with. So I think going forward, this whole review of what is it that we're going to do and what's going to be required, and more, it'll be more about how are we organized, what are the staffing ratios, all of those sorts of things are going to come into play with all those different levels of cares that you mentioned. And it doesn't stop there. It goes into all sorts of congregate settings, whether they're shelters, and you've heard Paul Johnson talk more about shelters and what it means for shelters going forward. We're going to see it in all sorts of different settings. And I think the question is how that's going to relate to the arrival of flu this season, and what more do we need to do to prepare? The timeline on this will be long in terms of some of those commissions and whatnot, but we'll need to be moving forward with some ideas about what we do to prepare in that shorter term. So that's been discussed at the health sector table. As I said, we're taking a first principles approach in terms of what we're asking of people, but the bigger questions of organization of care, of course, go beyond our reach for the majority of those settings.
And I would agree. I mean, there will be commissions and investigations and audits and all the rest of that. But I mean, I've been around and I've seen some of these take 2-3 years, and that would be 2-3 cycles of influenza. And so I guess my question is more to what can we do as a Board of Health and as public health here in the city of Hamilton to improve our outcomes in long-term care, residential care, and retirement homes, because clearly that's where our first principles may have applied, but the numbers were really crazy. And so we need to somehow tighten that. And I'm just wondering how we're going to be examining that here locally.
Okay. So I think there's a broader answer to be had there that may not be available today. So I'll charge Dr. Elizabeth and Michelle maybe to kind of turn their minds to that, and
I would appreciate
back
that,
on
sir.
that in the future. Yep, that's great.
Absolutely.
Thank you. So there are no further questions that I see, and so I am going to ask for a motion to receive the report. Councillor Marula. Okay, Councillor Marula. Go ahead. Can't hear you just yet. Oh, there you go. Your microphone.
Is that better?
There you go. Yeah.
Okay. With respect to the actual residents themselves, over the last few years, we've been assessing all of our all of our senior residents. And with respect to the residential care facilities, we were on the cusp of actually a new chapter. And I'm wondering, with your department and Emergency and Community Services, have we given a thought to perhaps bringing that idea forward quicker rather than later, or sooner rather than later, based on the recent dealings with these residential care facilities?
Doctor?
So through you, Mr. Mayor, just to make that distinction between long-term care, which is, higher level of medical intervention and regulated by the Ministry of Long-Term Care, retirement homes, which are for people who are seniors and who are regulated by the Retirement Homes Regulatory Authority, and RCFs, which are not seniors but are regulated by the city. And so as soon as we have people who are over the age of 65, then they become part of the Retirement Homes Regulatory Authority in terms of their oversight there. So for us, in terms of RCS, yes, you're absolutely right, Councillor. We do want to relook at that and look at how we go forward. Again, that's a fairly substantive piece of work that had begun, but of course had been put on hold in favor of doing the substantive outbreak control while we'd been doing this. And so I think this is where, as we look at our list and look at how we're going to proceed, and you're going to have before you today an overview and a beginning of a look at how we move forward. And then on July the 9th, you're going to have a look in more detail at how do we move forward with all of the important programs and services that are provided through public health services to promote and protect the health of Hamiltonians, just which approach is going to determine what work we can ultimately do. And so you'll see a sneak peek on those recommendations today, but RCFs, I'm sure Paul Johnson would agree, from a housing perspective, would be up there as a priority item.
Okay. So moving forward, how can we move up that discussion with respect to the residential care facilities, particularly because that falls within our jurisdiction?
Doctor?
Through you, Mr. Mayor, you could, of course, bring a motion. I would ask, though, if you let us sit back and see
Sure.
what's doable in terms of timeline, or I don't know if Paul
That's
has
why I'm
something he
asking.
wants to add there, but I think we need to sit back and see what's actually doable. Paul?
Okay. Oh, is Paul there?
Johnson?
Okay. Yep.
I am, and certainly I
go.
think we want to move forward on this more quickly. Give us the chance to come back, and by give us the chance, it's not several months down the line. We're actually having those discussions as we speak right now, and in the light of some actions that have been taken by some partner organizations, we want to move this along. So we had been looking at a broad review of it. I'm asking a number of folks now how we shorten the time frame on that broader review and actually bring some concrete things back. And so it would be helpful at that time to have some supporting motions directing us to speed that work up, because we will have to prioritize it amongst some other things that that occur if that's of importance. I can tell you it is of importance from a housing perspective as well as a public health perspective.
Okay, so through you, Mr. Mayor, to Paul, just so for the sake of transparency, we were going through a very exhaustive process with our residential care facilities, recognizing that there were issues. Through that exhaustive process and consultation, the program or the initiative was paused. And I think this would be an opportune time to go public with respect to how far we've come, why we've come this far, what the presenting problems were, and what our plan of action will be in the future. So at the appropriate time, I'll serve notice today that I will bring forward a motion at Emergency and Community Services, which I believe we're meeting on Thursday, if I'm not mistaken, or Friday, and at which time we can have just a brief synopsis or a very thorough synopsis, sorry, of where we stand on that particular issue, because I don't think the public were aware that we recognized that there was a presenting problem, that we were putting a plan of action together, and we were just imminently away of implementing that plan. So at the appropriate time, I will move that at Emergency and Community Services on Friday, and I look forward to that thorough report and presentation, because I think it will be an eye-opener with respect to how much we've recognized with respect to what problems exist and what plan we do have that we will be bringing forward.
Good,
And
thank you.
I appreciate your time. Thank you.
And while you're there, then, can you be a mover to receive this report? Moved by
Absolutely.
yourself. Thank you. Seconded by? What, don't, sorry? Okay. Okay, I see you waving. Go ahead, Councillor Pearson.
Second
Okay,
it.
let me get a seconder. Councillor
did.
Pearson seconded.
Yeah.
Okay. That was a misinterpreted wave on the part of our fine staff here. Any other questions? If not, a motion to receive the report. Please indicate your support or lack thereof. Okay, and that's carried. Thank you very much. And then we'll turn to the next item, which is item 9.1, and that's a staff presentation on the Public Health Services COVID-19 response and program. Let me finish my sentence. Reopening. And yes. Okay, Councillor Ferguson, we need your support on that last vote. So thumbs up if you would. Well, thank you. Ed, who else? That was it. Thank you very much. And we're back to that overviewing report on COVID-19 response and program reopening. So Dr. Elizabeth Richardson, who has done, I must say, a terrific job through this entire process, and kind of an, you know, there's many, I'm sure she'll deflect it to her team and the great people that have come together, and many others that have had a hand in this, but it requires some leadership and some decision making. And I think the doctor and her team have done a fantastic job. So I thank you for your great work, and I'll turn it over to you for your overview. Dr. Richardson.
Thank you very much, Mr. Bear. And you are quite right. I am going to talk about my team and the fabulous group of people that I work with, and just acknowledge the tremendous amount of work. We are by no means out of the woods in terms of COVID-19. I know it might feel to many like we're in a bit of a new day as we talk about opening up and having reached stage 2, phase 2 on Friday. But it is absolutely still something we need to pay attention to, and it is a world with COVID that we now live in. But it, you know, the team that's responded to this, everyone, you know, across the city, our EOC director, of course, Paul Johnson, otherwise known as our general manager of Healthy and Safe Communities, has been absolutely key to this. Our city manager, Jeanette Smith, I will never forget, Mr. Mayor, the day in your office when she looked at me and said, could I just put together some stuff to go out to councillors? And she knew the look on my face was, we can't do one thing more. And so she's just done a fabulous job at working with our comms people in Kevin to get all of those things out. Our health system colleagues, we've worked with through the Health Sector Emergency Management Committee, a very not so well-known group that gets together to coordinate and share information across the city. And of course, we've worked well with Ontario Health West more broadly. And, you know, the team in public health, I just have to give a shout out right now to this team that's on this call right now. And you're going to see the IMS structure, but just to acknowledge them as we start off here, our operations chief, who's otherwise known as our director of epidemiology, wellness, and communicable disease control, Michelle Baird. Our planning chief, otherwise known as our director of family health and chief nursing officer, Jen Vickers-Manson. Our logistics chief, who's one of our managers in our family health division, Marie Verbickus, who's on the line as well. Our finance chief, of course, comes from our corporate services colleagues who support us within Healthy and Safe Communities, David Trevisani and his group. Kevin McDonald has served as our communications chief along with staff from our communications section. And we right now have Jackie Durlov who's supporting us, but we've been very well served, of course, by Kelly Anderson before her and Laura before her. And then our liaison and medical specialists, Drs. Din Tran, Bart Harvey, and Doug Sider, who have Doug in the latter in particular has lived in Hamilton throughout his whole public health career, but has actually never worked in Hamilton until he came back to support us out of retirement to help us with this response. And it's been great to have Doug with us again as well. And then Bonnie King, who is usually a manager in family health, but stepped up and became acting director of all things that were not COVID, and continued to run our many essential services along with a skeleton crew of managers and a few of our staff. So of course, that's along with all the very many staff within public health services who kept essential services as well as our COVID response going and continue to do that today, and the many city staff who came to join us. So it's been a tremendous team and a tremendous collaboration across Hamilton that has allowed us to get to this point where we're holding our heads up a little bit and thinking about where to go next. So I'm just going to take you back over that time. I said when I was before council at the end of May that I'd come back and talk a little bit more about our response. And I think it is very important for the Board of Health to know where it is the journey that we have been on and to go on that together as we go forward. So we first, of course, saw COVID-19 then, and also still known as SARS coronavirus 2, which emerged from China at the end November of 2019, December of 2019, and then was in Ontario by the 25th of January. And we quickly in January had our first case in Ontario, as I said, but that not here in Hamilton, and had our IMS partially activated within a few days. That at that time we had 10 staff that were redeployed to initiate planning and collaborate with our health system partners to monitor where we were going with this. By February 11th, 2 weeks later, we were fully activated into this structure, which you've just heard me introduce the people who play those roles in this structure. And since that February 11th day, we've had a total of 304 of our 454 PHS staff at our peak redeployed to COVID operations, as well as 69 city staff who have worked alongside us. Right now, we still have 261 staff and 40 city staff, so over 300 staff working on COVID alone. So our journey, I'm going to go through and just hit a few more highlights. By March 11th, we had our first case in Hamilton. 2 weeks later, we had 35 confirmed cases. A month later, we had 5 times that many cases with almost 200 cases in Hamilton. And at this point, we're at, I think, 771 cases and just over 40 deaths due to COVID-19. What were we doing through all this time? So these are the 5 key areas that we've been working in. Our case investigation, which is looking at where people got and may have spread COVID-19. So that begins as soon as what was initially probable cases or somebody who had a test was reported to public health services, and then continued on into contact tracing as we were following up with each of the individuals who had been in initially close and more distant contact, but more so just close contact as we went forward. And so when we do contact tracing for so many other diseases, what we're doing is actually simply looking at who they are and maybe having one phone call with them. And similarly with our cases, but with these cases, we are actually following them and their contacts for a period of 14 days after they become ill. So as you'll see in a moment, the number of people that we're following, people may think, well, that's 771, that's not that many. But when you think about how many days they all had to be followed for, and they could have anywhere from 2 to 25 or more other contacts, you can see how the numbers really do ramp up. Data analysis has been a really important part of this, and you've heard us talk more about aspects of data analysis and what we should do and what we should collect. But there are reams and reams and reams of data that we do collect, and whether we can analyze all of that then and learn from it is also part of the challenge. And so our team, our epidemiologists have been working very, very hard to do that, make sure the data is good data. That as you can imagine, as people are working long hours, sometimes they tick the wrong boxes on our electronic systems. And so we have to go back and revise it and then produce what we call initially information, but ultimately intelligence in terms of what does this mean for us and what do we have to do and change. And so you think about our most recent upswing in our 20-somethings, we have to see that, detect it, understand it, and respond to it as we go forward. Protecting vulnerable populations has been a significant part of what we do. So this talks to long-term care homes here in this slide, and absolutely that's been a significant part of it. But as the councillor raised earlier, there are many other vulnerable populations in our community, whether they're in retirement homes, shelters, whether they are individuals who are living on the street. There are many, many people who are vulnerable in this to this disease, and they have been a focus throughout for this. And of course, we're not just looking at the impacts of COVID per se, but also the impacts of the public health measures, knowing that we needed to use some fairly blunt tools in order to control this disease, but those measures in and of themselves have an impact on people's health. And then, of course, answering your questions has been a key part of what we do, not just yours on council, but the communities more broadly. And our COVID-19 hotline has answered thousands of questions, booked thousands of assessment clinic appointments, and done a lot of work over these last many weeks. So just a few pictures, if you will, from our group. This is our case and contact management group in the early days. And you may say, are they 6 feet apart there in those early days? And you would be right. I mean, like all workplaces in Hamilton, as we began to understand this virus, we needed to change and modify our work environments, having many of our staff be able to move to working at home. But unfortunately, due to some of our data systems and other issues, for some people, they weren't able to do that and do continue to work in the office on a regular basis. And of course, that's on top of our many of our staff who continue to go out and do inspections and to see clients as well. Our hotline was activated on February 28th, and as I said, has taken many, many calls over the course of that time. We've also, by March the 13th, saw our first community acquired case in Hamilton, which made us understand that we were starting to see spread beyond what was being reported to us. So we'd only had our first case a couple of days before, but already had our first case with community spread. And we know at this point in time, and there's a huge upswing, which you'll see in the graphs in a moment, we were really dealing with issues of travel was still ongoing. We were having cruise ships come back, travelers come back, and it took us some time to get a handle on those numbers and just a huge upswing in the amount of work and redeployment of staff at that point. Nonetheless, we got assessment centers up and running with our health systems partners, with hospitals and primary care taking the lead on those. And of course, had our provincial emergency declared soon after on March the 17th. Our first outbreak happened on March 21st at Heritage Green, one of our long-term care homes, and it's never fun to be the first one to go through it. As you can imagine, they dealt with all sorts of challenges, from being the first to really have to deal with wearing iPad or wearing PPE to the extent that they were, to dealing with a lot of fear and distrust from not only the people who were working there, who were worried about what was happening, but also from the community around them. When workers would try to go to get something to eat on the way home or whatever it may be. Our first death happened on March the 24th, and then we went into the process of doing IPAC audits, and this is a part, I think, Councillor Clark, of what you were drawing our attention to earlier, the degree to which we went in and began from a preventative aspect to make sure that these residences were ready for what might come if they were to have an outbreak. Soon after, testing was expanded, and we began to do the same process that we had done with the long-term care homes. We began to inspect our farms with migrant farm workers, and of course, we've seen the extent of infection that has happened down Erie St. Clair Way, as well as down in Haldeman, Norfolk, and a lot of the challenges there. We're fortunate to have these individuals come and work in our community, and yet they come and live in living conditions that are very crowded, and they have lots of cultural barriers to understanding our system and how things will work, and so it's a challenging environment for all. Just going to take a look here at our flattening the curve. So our case and contact management work, but really all the work that was done across the health system really did help to flatten the curve. So although we were in that upswing through March, we saw a tremendous effort go on in our community in terms of people doing all the things that needed to be done, staying home from work. Unfortunately, that led to a number of businesses needing to shut down, as well as they couldn't do the control measures, and as the province started to put orders in place. But it absolutely had an impact in terms of saving lives. It was interesting to me this weekend. One of the things I was looking at as we've tried to understand is the death rates that we have experienced in our own situation. And when I look at some of the long-term care home outbreaks and retirement home outbreaks that have occurred across the province, many of them had attack rates that were nearly 100% and had death rates that were in the 30 to 50% range. And so absolutely our larger ones were definitely challenging. We've had difficult issues, but fortunately, we haven't had some of the issues that others have had. Our surveillance, as I said, began in congregate settings, first with testing in our own shelters. And Dr. Tim O'Shea and a few of our public health nurses were working out in those shelters to do that testing and make sure that we were aware of whether or not there was COVID-19 in those shelters. And we were very fortunate. There was, of course, 1 or 2 cases, but on our regular screening that happened, we didn't find any. And as we go forward, this team will also now be looking at migrant farm worker housing to help look at those settings. Our long-term care surveillance also began. Challenging, very challenging in terms of the number of tests and the handling of all that data. As I think you might have heard me say before, it was about the equivalent of all the data we get in an entire year coming through in a week or two. And so having to manage all of that very quickly was challenging. We did open our drive-through testing site. Thanks very much to our colleagues in Public Works who helped to get this together, and our colleagues in Rec at the Dave Andrzejczyk Arena, and figure out how would we run this drive-through. We thought initially we were going to do it outside, and we were still, of course, dealing with rain and snow that continued on, and cold. And one bright individual said, "Why don't we just run it right through the Zamboni door?" And so that is what we did. And we've had tremendous volumes of testing through this site. Just a shout out to our primary care colleagues, our hospital colleagues who are running these sites to this day. They were designed to see 206 people a day, and they've been seeing upwards of 400 people a day. And so we are working very hard with our health sector partners to try and look at other alternatives to maintain testing as we move forward with testing, knowing it really is a backbone of how we handle this illness. But just yeoman's work. Everybody has gone above and beyond what capacity should otherwise say they should be able to do. So as you know, we've moved now into this idea about reopening, and our workplaces are reopening, and our childcare centers are reopening. Our schools, of course, have remained closed. But as we reopen, there's a lot of work as well in terms of supporting all of these businesses and organizations, deciding who it is that we're going to inspect. So for example, we decided we would, based on our experience with our other settings, we would inspect childcare centers before they reopened, but we got together a team of inspectors who could do those in a few days, just as fast as the childcare centers could reopen themselves. Put together information so that they had a checklist that they could go through and look at what would they need to do in order to be able to reopen so they could get well prepared, before we even got there. So there's been a tremendous amount of work, and we expect that work to continue as we reopen more broadly and in supporting businesses and others as we continue to live in a world with COVID. So here is our epi curve. And as you see going along here, it looks like a slow and steady climb perhaps, but that certainly didn't climb in that exponential curve that places like Italy and Spain experienced. And we're very grateful for that. You do see some of those milestones along the way, and certainly the number of cases, we were able to see more. You've heard me use the iceberg analogy. We were able to see more of those cases as we did things like the surveillance testing at long-term care homes. And as the testing criteria further expanded, once we got more swabs, the lab capacity has been greatly enhanced, a lab network formed, and just there has been so much change in the way we do business here in Ontario from a health perspective because of this. There's virtual care that is provided that did not exist before. I think the hospitals today were saying something like 70% of their ambulatory care clinic appointments are now done online, whereas that would have been a very rare occurrence before that. So a lot of changes that have been really good. We have, of course, unfortunately had some significant outbreaks, and things like this spike that you see here relate to the Roslyn outbreak, in which we had a 64 out of 66 residents who had lived in that premise become positive. So more recently, though, you'll see it's staying kind of level with that gray line. And so although we're at 771 cases, we have 97 cases actually active today. So many of our cases at this point, over 80% have now resolved, which is another good indicator. In the past 2 days, we've had only a couple of cases, none on Monday, 2 new cases so far today. And, as recently as a couple of weeks ago, we were at 10 to 15 cases a day. So it's been a steady drop since that point. By comparison, in Ontario, they have 32,000 as of 10:30 this morning, and our rate is sitting at 5.2 cases per 100,000 population over the last 7 days. So that's one of the indicators we've been following as we go forward. Here is a little bit more detail, and you can see these blue cases that started out. These were the travel related cases, and then we started to see it in the contacts of those who had traveled, as well as those purple community related cases. And those outbreaks that you see are just represented by 1 or 2 cases, but really could be much larger in terms of their size, at least in those initial periods or from time to time throughout. So we see sort of these 3 waves that have happened of virus so far. The other thing to think about in terms of those outbreaks is there are a number that happened along the way. The definition was that any case in a resident or staff in a long-term care facility or a retirement home would be counted as an outbreak, even though we knew with the degree of lockdown in those facilities, the staff person came in, the transmission wasn't happening there, but rather was happening elsewhere. But so that just is something to bear in mind as we're looking at the outbreaks. From a severity perspective, 18% of our cases in Hamilton were ever hospitalized. That's a little higher than Ontario's average at 12%. The percent of hospitalizations ever in ICU, though, is lower. So at 15% in Hamilton and 21% in Ontario. So there's no doubt those numbers for Hamilton are influenced by the fact that we did have the decanting of people from the Roslyn Retirement Home into hospitals. Number of deaths for us, 42, of which 32 of those were outbreak associated. And overall, 82% of our cases have been resolved. Public health capacity is one of the things we were tracking, as you know, is one of the factors considered in the province's reopening plans. And so to date, we've had over 24,000 calls to our hotline. And so it does ebb and flow over time, depending on the issues that we're experiencing. And I think our staff are a little tired of us, activating more people, reducing the hotline only to have the next thing. And to quote Bart Harvey, who's not able to join us today, basically every week or two, the virus would throw us a new curve, or we'd have some new directive from the province that would have us having to change and pivot, as Jen likes to say, in terms of what we're doing. We've had no cases along the way that are lost to follow-up, which is fantastic. The team has done a wonderful job in creating connections with these individuals when they are contacted and maintaining them as we go forward. You can imagine it does get a little bit worrisome for our staff as well sometimes when they can't reach somebody who they know that's monitoring that has COVID-19, when they know that people have been known to get ill and be severely ill. So we've had to do health checks and send people out, and again, then that puts our staff in a position where they're needing to go out and be in contact and make sure that their health and safety is protected as well. Our periodic monitoring, as I said, has been done for 100% of cases, and we are reaching new cases within 24 hours for 93%. The target that the province has set and that we would very much agree with is that at least 90% of them we can reach in that time frame. And similarly for our contacts, we're reaching them quite quickly. Just to get at the sense of the number of contacts, so we only started tracking it as a separate number since about a month ago, but in that past month, so you saw the number of cases that we had. This is the number of contacts, and the scale is quite different. So here we're up to 80 that would come in on any given day. We had 75 new contacts alone that we had to reach and establish a relationship and then monitor for the ensuing 14 days. So the numbers do go up and down as we went forward, but 932 contacts followed, which would be for, 15 times as many phone calls and days that would have been monitored for. Our testing capacity, of course, this has been the subject of much discussion and focus as we've gone forward, remembering always that a test is as good as it is that day. And so using it in a setting where somebody is ill or where you have an outbreak is where we're using it for diagnostic purposes. In other times, like with the long-term care home testing, retirement home testing, our migrant farm home worker testing that we're talking about, it's really a means of surveillance. It's a means of trying to understand what is going on and how much is out there. So overall, we've had 5,000, almost 5,000 tests completed in the last 7 days from June 9th to 15th. So our number of tests has gone well up. There were, of course, through these time periods we were doing the long-term care homes, many, many tests that were done. And this was before our labs across the province really had fully built their capacity. So unfortunately, at times it would create these delays that people have found frustrating in terms of getting their results. And we've heard several complaints to that regard. And the province has been working hard to get their testing capacity up. And now, in fact, our test turnaround time is very good. Our staff, you've heard us talk about the number of people who have been deployed, and there again is the number of people who are currently deployed. 221 of our frontline staff remain deployed, 30 of our public health services leaders. So that's 75% of our supervisors, managers, directors are dedicated to COVID. We've had 9 retirees come back to work with us, which has been fantastic. And of course, Doug Sider, who's our public health physician who joined us and is very much an expert in infectious diseases and infection prevention control, having worked at Public Health Ontario on that in the recent past. And as well, we still have these 42 city staff who were very glad to have work with us. And you can see that week of March break when the travelers were our main source and were coming back, that's when it really took off and just had to very, very quickly redeploy staff, move staff into these, train them. As you can imagine, it takes a significant amount of training for people to move from what they may have been doing to the kinds of work to do case and contact management, understand the disease, understand infection prevention and control in a way they haven't had to before, and then move forward with that. And we've stayed at this very high level of deployment since then. Communications wise, I think our comms team and our staff within public health services that support it as well, Heidi McGuire, they've done a wonderful job of getting the information out there. And you can see that in terms of our page views on our coronavirus page. Of course, there's a lot of city information that is there as well, but hundreds of thousands of views that went to those pages, especially as you saw through that period in March when things were really ramping up. Lots of tweets, Instagram posts, and those sorts of things. Of course, the other issue that we've been very, very focused on is the impacts of this physical distancing and the kinds of things that we're having to do on people's mental health has just been very important. And so going out, this is one of the tweets that you would have seen go out of many of them that have around taking care of your mental health and keeping in touch, making sure to recommend that people unplug from media and social media and really find a balance in our day. And of course, this has been very important for our staff too. It's been stressful for them. Many of these staff came in to do work in very different areas, and that's really where their passion lies. And as great as they have been and loyal in providing the services that are needed at this time, you can imagine that the having to change the way you work, who you work with, all of those sorts of things, the challenges of having to come into the office. And the time we've gone through in terms of making sure that people are distanced and the paying attention to those things, they all do impact people's mental health as they are continuing on with very good work. These are the metrics. I gave you a sneak peek of these at our May meeting. This is them in more detail now. We continue to monitor virus spread and containment through a number of measures. Our health system capacity is very important, and it's stretched because of the fact that people hadn't been able to be admitted from long-term care from hospitals back into long-term care. And so there is a backlog again of individuals occupying those beds in hospital that need to move to a better living situation. And so we start to see Directive 3, which allows that to begin to happen. And they're looking at other solutions as well. Public health system capacity, the ones that we've looked at, but we also monitor the number of staff who are absent each week as a measure of both illness and as well stress as they go forward, and monitoring the number of overtime hours that are worked each week. We saw, particularly as you saw that ramp up in staffing that happened in mid-March, the amount of overtime then was huge as well, as we scrambled to get people working and trained and ready. So the people who were already able to do that work worked a lot of overtime while we trained up the people who would soon be working alongside them. So since then, our overtime hours are well down and really only come up if there's a particularly acute situation or a rapid pivot on the government's part. Incidence tracking capacity has been another set of measures. So again, this brings in our testing rate, the turnaround time on the testing, what percent are positive, which has steadily decreased in our drive-through, which we think of as a good indicator of general testing. And then we also want people to get rapidly in to be tested. And then we are tracking this suite of indicators along with our partners in the city and looking at vulnerable populations again. So mental health related emerge visits, police crisis response, paramedic incidents for opioids, all of these things are being monitored as we go forward. And most have sat below historic thresholds, although some of those were higher at the beginning and then came down and now are starting to creep up again. So we've heard about our IMS structure, but this purple box is how we kept our usual business going. And of course, while we had many people redeployed, we also continued to have many people providing programs and services in the new way of doing business in COVID. And so these are our essential services, our critical services that were maintained, including our mental health programs, mental health and addictions programs through ADGS and child and adolescent services. Of course, there are many other communicable diseases that we need to follow up and track. And in the early days of COVID-19, we had many other outbreaks that were going on due to other viruses that were being managed, and not so much now as we moved into this season, but the summer viruses will make their way through as well. We continue to provide emergency dental services, not on the bus, but through our clinic, and our staff provided services there. Our home visits, now in this setting, our home visits were virtual visits for babies, children, and families. Our mental health and street outreach folks continued to be out on the street working with individuals who were there. Naloxone distribution, as we've talked about, was important. Rabies, you don't get a second chance at rabies. You have to do the investigation at the time. And our urgent health hazard complaint investigations continued forward as well as continuing to deliver vaccine to our primary care partners and others who were trying the best they could to continue to vaccinate the new babies that were being born and the children who needed their vaccines. Although we weren't able to do, of course, any school vaccination clinics. And so we have a significant buildup of activity that needs to be addressed there, and the province is working on a plan for how we do that. So as we've gone forward, we've worked on a reopening plan, as you've heard, for other parts of the city. And so we've been looking at going forward in a staged manner. So reopening those high risk programs where we really need to get back to it to reduce the risk. And so I'll go through and talk about some of those in just a moment. Others where the risk is a little bit more moderate, but as soon as we're able to make a change, either because control measures are changing and so we can now do some things that we couldn't do before, or there are activities that are resuming that we couldn't do before, and then the lower risk public health programs needing to resume. And as we've talked about through the performance indicators, and I couldn't have asked for a better introduction to this in many ways, because it reminded us of all the programs and services that are done within public health services to support the health of our community. And we know our health is determined by, and there are health issues far broader than COVID-19, and we very much need to get back to that work. So our phase one reopening focused on our dental clinics, expanding our emergency treatment capacity, adding a second chair to see people who are coming through. There's usually 3 chairs at the RTB plus the bus. And they have been focusing on treatment only, and we need to get them back to doing prevention in many ways, as was pointed out earlier. We're also looking to plan the reopening of the bus. The challenge has been that the sites where it goes are closed, and so we can't go there if the site's not open. So as those start to change, we'll be able to do that as well. Food safety inspections of our high-risk food premises. So they've been started in the first quarter, but then delayed as we went through COVID-19, and we need to get back to those. These are, again, long-term care homes, hospitals, but restaurants that were open and doing takeout, as well as farmers markets, food trucks, those sorts of things. And so since they restarted on May the 4th, they've been at that for a month now. They've gotten 377 inspections done, with us often, unfortunately, pulling their colleagues back to other issues like the childcare inspections. And so they've been doing this delicate dance of trying to do multiple things. And this is one particular group of staff where we do not have enough of this expertise to carry forward. And so one of the things we have to think about. RCF inspections have also been a priority in terms of IPAC throughout this situation, but we need to get back to the broader inspections. And so those have been part of what we've been restarting as well. So far we've done 34% of our environmental inspections, 20% of our nursing inspections, and 20% of our food safety inspections. So we need to get those back up and running. Harm reduction is very important. We've talked a little bit about naloxone and those issues, but our street health clinic as well, and we're working with our partners to get this back up and running. Hopefully within the next week or so, we'll have that open earlier than the initial target of the 1st of July. And then vector-borne disease, I think this came up one of the last times that we did talk around Lyme disease and West Nile virus. Rabies, of course, you've heard me talk about, has continued, but we have started the process around managing West Nile virus and are doing, again, Lyme disease work and other resources as we go forward. Just reminding ourselves again of the priorities, and we had added climate change as a priority here. These are no less a priority today than they were, although there has been some really interesting opportunities. The whole thing that it all depends on how you look at it and how you accept the challenge. So there are several opportunities that we're seeing as we go forward. As many of us have noticed, there are a lot more people who are active out there as they're trying to get out of their houses and do more things. As we look at the school year, a lot of our focus for this particular priority was around school travel planning. And I think if we're able to get students back to school this fall, again, this will be a priority area because it will allow for social distancing or physical distancing, I should say. And that's going to be a good thing, an opportunity, as I said. Virtual breastfeeding visits were another target here, and we were able to implement those more quickly. We have our nurses doing those virtual clinic visits now. Mental health and addictions has been key throughout. It's been an area that we've both maintained our clinical and direct client delivery services for, but we've also been able to do more mental health promotion and real focus on the importance of wellness, the importance of connection, the importance of these things. And we've been collaborating with the CMHA and our partners to adapt our mental health care delivery models. In climate change, we've talked about some of the pieces that moved forward last year. We, of course, have experienced the benefits of decreasing pollutants due to decreased transportation traffic and those sorts of things. But we've also adapted our heat-related illness plan throughout this to be able to respond in new ways. And then, of course, from a health equity perspective, we've been working with the city EOC around the isolation shelter, a larger shelter for homeless clients. We've been working to support those in the Indigenous community. That we've done a lot of work there, building relationships and helping them in the ways that they've asked for to develop campaigns, establish call lines for within their own providers. And then, of course, we began the race and income-based data collection and looking at congregate settings as we go forward, as we talked about earlier, is going to be something that is very important. So just a sprinkling of the many programs and services that are delivered, but are so need to continue to happen in order to support health and wellness in our community. So as we move forward, we do need to look at how we organize and resource ourselves in order to provide those Ontario Public Health Standards programs, as well as programs like child and adolescent services, alcohol, drug, and gambling services, mental health and street outreach, and a number of other programs and services. And so we're going to have to do that while we continue to respond to COVID-19 in an effective and timely way. And as I said earlier, this virus, either itself or through some of the things that we learn that are effective and need to do, really does have us need to be flexible and responsive as we move forward. So, and these numbers are updates. We didn't have them by the time we did the report. So these are the first times you're seeing these in terms of the presentation. So what Michelle, Kevin, Jen, myself went away and talked about in between many other meetings with partners and whatnot was how could we be sustainable going forward? What did we see as what was likely to come as we talk about the backbone of continuing to manage COVID-19 being case and contact management, IPAC, and particularly we've seen that we need to be on the ground, more visual inspections rather than just phone calls in our congregate settings. But these things continue to be the backbone of what we're going to do. And so as we're doing that, how do we structure, how do we resource it so that that can be done? To date, we've got, as you've seen in the reports presented earlier, about $1.6 million in pressures that are related to COVID-19 net pressures. We estimate going forward for the remainder of 2020 that there's about 128 FTE for COVID work alone, of which about almost 18 could come from not doing other programs and services that just we cannot do right now because those settings don't exist or aren't anticipated to be up and running during 2020. Or could be deferred until 2021. And so the net impact of hiring those additional staff on a temporary basis would be 2.9 million. Our estimated annualized impacts, if we're continuing to do the same work in 2021, would be that 128 FTE over the course of a year. And that would be at a cost of about $9.4 million after offsetting from, again, not doing some work during the next year. Now, of course, these are preliminary numbers. We're continuing to work on them. Paul and I will be meeting to talk about whether there's other places we can look at redeployment from. As you've heard, we've had some real success in terms of that from the city, but we'll be bringing you back to the July Board of Health some more specifics around this particular piece. So just want to conclude with a few of the great tweets that we had going forward. So this is a cheer out to our childcare partners who continue to provide childcare to emergency and frontline essential staff and the people that supported them in those settings. It was a very important part of people continuing to be able to work, and a really well done piece here in Hamilton where we use these small service providers who then could minimize the number of people who are in contact and minimize transmission. And it worked very, very well as our testing and child care center staff showed. This thank you that went out to those who are helping to get people tested and working with institutions supportive housing to manage the outbreaks back on April 28th. And that testing, as you heard me say earlier, was a huge effort. We don't usually do testing. This has been one of the challenges in this response is people say, well, public health's doing the testing. Nope, we're not usually the people who do that. It's the clinicians out in the community, primary care, emerge docs, other people who do that. But we worked very hard with the long-term care agencies to organize and get this testing done within the time frame that was set out by the province. In fact, several days in advance of that timeline that was set out by the province. And of course, our inspectors who continued to support our food premises, but also went out and did many of the inspections in these long-term care homes and in our migrant farm worker housing. And, very challenging to go into some of these settings that were struggling, particularly to inspect, to give advice, to try and make things better. And I think I've gone backwards. but also to our hotline staff. At this point, we've done 5,500 phone calls, and as you've seen, we've done many, many thousands more than that. But this group of staff have done everything from booking appointments into assessment centers to answering general questions to helping businesses in terms of their questions and fielding them on to our IPAC staff who have helped support them as well. So just a tremendous group of people and a tremendous amount of work that's been done. And that's it for me. Ready for questions. Mr. Mayor, I think you're muted.
Technology, wonderful thing when it works brilliantly. Thank you, Doctor, for all of your good work, and of course this report. This is an ongoing process. Obviously, this is not beginning to end with a presentation today. This is going to be with us for a while, and certainly everyone's stepping up in a kind of rather uncertain kind of process, and figuring out what we needed to do and how we needed to do it was no easy task. So kudos to everyone that had a hand in that, including Paul Johnson, the EOC team, and council, quite frankly, for allowing folks to do what they need to do. There were everyone had thoughts and ideas, I'm sure, about what was the appropriate direction, but we needed quick action on all of these fronts, and we had the right people in place to make those decisions, and you were one of them, and so was Paul Johnson and many, many others. And as a result, I think we fared pretty well, relatively speaking, given the context of other communities that we're compared to. So thank you again for all that great work. We have a lineup of speakers, starting with Councillor Ferguson, and then to Councillors Pearson, Jackson, Nan, and Marula. Councillor Ferguson, you're first. Councillor, yeah, we go.
Yeah, can you hear me? Because it's still showing as I'm moved.
No,
okay. Thank you very much. And Elizabeth, congratulations to you and your public health team and our public works team and all the other city staff that have worked hard to bring this together. Early days showed it was going to be a lot worse. All the forecasters telling us that we're going to overload our hospitals, and it didn't transpire. And I think it's because you got out early, and probably the most successful part from what I see, of course, I'm not inside in the emergency operations center, is the education program. And people are social distancing. I don't care where I go, whether I go to the grocery store or whether I go to the hardware store or whether I go to a dealership. People they stop and back up if they think you're getting too close to them. Very respectfully, but it's worked. I was telling the mayor earlier, I'm just a little concerned that maybe we scared them too much, but I know what you're trying to do was to get to that 5% that don't care. But I talk to people now that they won't even go to a grocery store yet, even though they're well protected. And I know the restaurant industry is very concerned. Once it does open up, they won't get their customer base back because people are just frightened. So I don't know how we get around that as the days go on. But I really only have one question. We went into phase 2 yesterday, which was very welcome. And I know I'm scheduled to have my hair cut first thing Friday morning. I got in there, and so I won't look like a bum anymore. And but my question to you is, a lot of people in the community use our municipal service centers, and I see some municipal facilities are allowed to open, like spray pads and whatnot. But here in Ancaster, and I'm sure it's the same in the other municipal service centers, there's only 2 staff here. They're well protected by furniture to separate the public from them. Similar to what you see in grocery stores or hardware stores or dealerships, is the plastic screen that you suspend from the ceiling to give them further protection. We're coming up to tax time due with June 30th, when for some reason, I know you can do it with 2 clicks of the mouse on your with your bank, but a lot of people still aren't comfortable with that. They like to come in and hand a check over and get a receipt, and a lot of them even bring cash. But we're still closed. And so my question to you, because of the safeguards we can put in place, we can put marks on the floor for the 6-foot spacing. When do you think we could start to reopen some of our municipal service center? I had one poor lady calling and calling and calling me. the clerk directed me to send her to Oakville because she thought they were doing it, but she had to get married for health reasons and couldn't get a marriage license. And there's death certificates, and there's all kinds of services that we provide to the public through our municipal service centers. When do you see we can start to open them up again?
So thank you, Councillor Ferguson. Through you, Mr. Mayor. It's a bit of a combination of things in terms of what can open when. Of course, the province still has orders in place as we go forward in terms of what is allowed, and they're slowly making progress through that. And then that's combined with our own capacity to reopen and redesign those spaces. So probably that question is better answered by Paul in terms of plans for reopening there.
Okay, Paul, I know. And Paul, I have talked to you about this on the telephone also. But when we open up phase two,
online services available for marriage licenses?
no, you have to be there in person.
Okay.
You have to physically interview them. I had a long conversation with Andrea and Lisa about that, and they can't do that. So Paul, when it just seems so simple when you look at grocery stores and hardware stores to be able to put marks on the floor and put those plastic screens hanging from the ceiling to get our municipal service center. And I was excited when I saw the list that was available yesterday to open is municipal facilities, some municipal facilities. And, you know, we deferred until the end of June, the submission of your taxes. And when I sit in my Ancaster office, I see the big lineups at tax time because people want to take advantage of that. So when can we get them restarted?
So through you, Mr. Mayor, I don't have a definitive date, but I can tell you a little bit of what we're doing to get ready for that. So the Emergency Operations Center has approved Public Works to begin the exercise of changing all of the counters physically. So they have the plastic barriers there. There are 246 of them that need to be done. And I understand that's not all municipal service centers, but we are prioritizing them based on some other things that are going on. Obviously, we are opening up some municipal facilities, but they typically are based now on recreation. We're preparing for pools. We've already opened golf courses and things like that. The other piece on marriage licenses is that the EOC has asked that there be some process developed, which would allow us on a case-by-case basis to bring people in, not on a come whenever you want scenario, but if they call, we're going to look at a way that they could come in and do some of that, because some of these things are out of sync a little bit for us. So we haven't quite opened our municipal facilities, but now there's a little bit of a relaxation on the number of people that can come to wedding ceremonies, not receptions, but the ceremony side. So we're trying to react to that. So in terms of a specific date, I can't provide that for you today. It is not part of this phase of the reopening for the city's piece. It's much more focused on other facilities such as our pools and our splash pads, some of those outdoor amenities at the moment. But we are moving towards it, but it is not going to be in the next couple of weeks. I can tell you that.
So you can't have it opened up by tax time?
Through you, Mr. Mayor, no, that doesn't appear to be a possibility right now from where I sit.
Okay, because it doesn't look that difficult to hang these plastic shields from the ceiling tiles, and I'm surprised. It's interesting you got that many. There's only 2 here, and okay, I'm going to stay on it, Paul, because it's a service that's very important to my community, and I'm sure it is to other members of council's constituents also. Is Parks underway opening spray pads now? Because we're going into a heat wave starting tomorrow.
So through you, Mr. Mayor, we through the EOC, we asked Public Works to begin the readiness for spray pads in anticipation that they can be open, recognizing that as of tomorrow, spray pads are not open. This happens once we hit Friday. So pools and things are not allowed to be open, but we expect that we'll be able to bring some of them online fairly quickly. Pools will take us probably 3 to 4 weeks. There's a lot of work that needs to be done on 2 fronts. One is to get the pools actually physically ready to go. There's actually a startup process that's fairly involved from a Public Works perspective. The second piece is we have to do a large amount of training with our lifeguards. There are different approaches to life saving, obviously, because of the close contact that life saving has with individuals. So we have to go through a PPE exercise and a training exercise with our lifeguards. So those things are coming along slowly, but we were anticipating that this week or next was sort of our anticipation we'd be entering into stage 2 provincially. So we're a little bit further ahead. Can also say that, you know, public washrooms, we're starting that process of opening. And of course, on Friday, public beaches are able to be opened as well. So people who, some of whom have been using the beaches anyways, but legally, you're able to go and sit on the beach as of Friday as well.
Okay, so the spray pads, I get the pools. I think the public would understand the pools. The spray pads is getting in the manhole and get the valves opened up and maybe change some heads. So I've watched them do them. It doesn't take them long once they get to it. So I know Friday's the start date and it takes a while to turn them all on, but by next week, some should be up and going. Would they, Paul?
So through the mayor, yes, absolutely. We worked with public health. They've signed off on the signage that will be up around physical distancing, and also have looked at how we're going to reopen them and are fine with that. So we worked with public health in advance. Public Works is out doing their work, and our expectation is they will come online faster than our pools for sure.
Okay, well, thank you, Paul. You've done a great job. You've been very forthright with me. You always answer my calls, and sometimes I don't like the answers, but I understand why you've done what you've. You've been a great help also with making the decisions at the Conservation Authority. So, thanks very much. That's all I have.
Okay, thank you. And still, all of it, you know, dictated by the province in terms of what opens when. So we're certainly in their hands, but we certainly continue to advocate. Councillor Pearson.
Thank you, Mr. Mayor, and certainly thank you, Dr. Richardson and Paul, everyone, to all of the staff who've been working on this in the EOC Center and throughout the city. Phenomenal job, and you're absolutely right, everyone, that this could have been a lot worse had our staff not been as quick on the draw to make the necessary and important decisions that got us to where we are today. So one question I have, and it's just with regards to going into stage 2, and I've received concerns from some citizens who have family members in like St. Peter's nursing home, et cetera, that they're going to be opening up, and I'm assuming that's as of Friday. So Dr. Richardson, are there any concerns with regards to this? Because I'm getting family members that are very concerned.
Yeah, I can, through you, Mr. Mayor, I can imagine the concern. You know, these families and the residents have been through the ringer with not being able to see one another, and the very difficult circumstances that brings, and knowing that many of these people provide such important care as well, not just spending time and enjoying their relationship, but also providing important care for their family members as well. And so as we go forward, you know, it will be a bit challenging for people to accept that now it is okay to take these incremental steps forward. And so this first one with the changes in Directive 3 are, you know, a small step forward. And I think that's a very good way to take this and start to slowly move us. And what we're looking to do is see what happens when we do. It is so important that we continue to be so mindful of all those public health measures they need to stay in place. We've been in training, we're like athletes that have been training for the last 3 or 4 months, and we have to continue to do those things in order to keep the spread to a minimum. And as long as we do that, we will monitor it across Hamilton, across the province, to see what the impacts are. And if we find that any of the measures are not things that we should be doing, or the reduction measures are not things that we should be doing, then we'll need to take a step back and reintroduce some of those. But really, it is a cautious move. It is a slow step forward, and it's one we need to take. As human beings, we need more than we've got right now. We need the hugs from our family members. We need to see each other, and so it is important to give it a try.
And I appreciate that, certainly, and we'll certainly extend that to the few residents who've called me that have family members. And I obviously am aware it's the concern of, especially when there's mental challenges and issues where you're now stirring up a family member, or other people coming in are stirring up family members of others because their family's not there. So I appreciate that. And I truly appreciate the fact that this will be monitored very closely, that we don't end up having, you know, a spike in outbreaks because of this, because of allowing this to open up in the nursing home specifically. So thank you for that answer.
Thank you. Councillor Jackson.
Thanks, Mr. Mayor, and Dr. Richardson. Couldn't be more proud of the Emergency Operations Center team led by yourself and General Manager Johnson, our mayor, and the entire extent of all the departments that had representatives helping our city get through this awful pandemic. Mr. Mayor, just bear with me. I just have 5 quick questions. And Doctor, you've covered them in the width and breadth of your 35-page slide presentation just now. But just for my constituents and for my edification to be crystal clear, on a positive note, Doctor, although every life is valuable, we've had about 40 plus deaths in our city only and 771 positives. Wherever I've gone in the last 2 or 3 weeks, especially specifically within my ward, but even beyond, I've generally had people approach me to say, social distancing still, approach me to say that they feel good overall about what the city of Hamilton and our residents have accomplished, especially in light of other municipalities, provinces, and countries. Is that a fair, encouraging, positive assessment, Dr. Richardson?
Through you, Mr. Mayor, I would agree. The city has done very well. Our province has done well, but our city has done well, and it is as a result of the whole community taking to heart the control measures and putting them in place, and our, providers who have been working so hard, our long-term care home residents, our retirement home residents. There's always some that don't do it. There are always some that are going to be a challenge in it. And that is what we've been there for, to help educate people, as Councillor Ferguson said earlier, and then to follow up and make sure in that the controls are happening and that people are there. And we can't be perfect. We can't be everywhere all the time. But we have done really well as a community.
Thank you.
That's good. Thank you, Doctor. Doctor, for the skeptics, the few skeptics still, which conversely now, when I run into those and basically roll their eyes, Tom, what was this really all about? And the skeptics, Doctor, always point to the fact that, Tom, hundreds of thousands of people across the world die of the regular annual influenza. Dr. Richardson, one more time, please, through you, Mr. Mayor. What was the potential greater fatalness, if you will, of the medical community's concern of COVID-19 versus the typical influenza?
Through you, Mr. Mayor, there is that very good analogy to influenza, and unfortunately, this is much more serious than influenza. It has a higher death rate than influenza does, and because it's a new virus where we don't have a vaccine, we don't have treatment, we don't have any of those things, we really needed to take these broader public health measures. And we've seen, unfortunately, for our global citizens around the world, that we have seen countries where they weren't able to take those measures as quickly as we were here in Ontario and in Canada, Hamilton in particular. And what the impacts were, the villages in northern Italy who were just devastated by this. And the results then were both those who were impacted by COVID itself, but also those who couldn't get treatment for other conditions because the ICUs, the acute medical beds, were overrun with people who are being treated for COVID-19. So people who are dying of heart attacks, strokes, cancer, other things, because they couldn't get the treatment they needed. So we did a fantastic job at preserving our care capacity so we could go forward. In fact, we had people who were scared to come forward, and we know that's been a concern too, that people need to still go to emerge. They need to still go in when they're not feeling well. If they're having any acute signs, call their primary care doctor, go into to be seen. But the toll could have been much, much worse than it was.
Okay, thanks, Doctor. 3 more quick questions, Mr. Mayor. Dr. Richardson, I need to get these clarified for a number of my constituents that will be listening in on this meeting. You need to define for me again public health services of the City of Hamilton's role of versus retirement homes and long-term care facilities. Obviously, the worst examples was the Roslyn, Heritage Green, just sadness and tragedies across the board where the outbreaks were enormous. Again, is it the responsibility of a local taxpayer paid for public health services department led by you to annually, regularly go into the retirement homes of our city to all the long-term care centers and homes and lodges of our facility as part of annual inspections, or is that entirely with the ministry? If you could give a definitive statement one way or the other, I would be grateful.
Thank you.
Through you, Mr. Mayor. So for long-term care homes, it is not our job to monitor care in those homes. That is the responsibility of the Ministry of now long-term care, before that the Ministry of Health. And so they have an inspection program, and we've heard a lot about that over the last couple of months. It is our responsibility to do two things with those homes. One is to inspect them from a food premises perspective, so for food safety and to make sure food production is safe. And so we go in 3 times a year and follow up on any complaints related to food safety. It is also our responsibility to work with them around outbreak control. So if they're having things like influenza outbreaks, those sorts of things, we work with them and do work with them to educate them around the year, throughout the year, around infection control more generally. So those are our responsibilities. Similarly, for retirement homes, we're not responsible for the care that happens in those homes. That is the responsibility of the Retirement Home Regulatory Authority, which is accountable to the province. And we do, again, there go in and do food premise inspections for the same reasons, and we support them if they do have outbreaks.
Okay.
Councillor Jackson, we're
Yes,
at the
Mr. Mayor.
5-minute mark for you, so I've just got the indicator. Did you want to finish up, or do you want to come back on the speakers list?
Put me back on the speakers list because I have 2 more questions. Thanks, Mr. Mayor.
Okay, thank you. Councillor Nan?
Oh, thank you, Mr. Mayor. I wasn't ready. Quickly though, thank you joining the chorus, Dr. Richardson. Definitely to all public health staff, the additional staff, are definitely our EOC, the mayor's office, and everybody in bringing us to this point. I had a few questions based on the report that you had given. One particularly around the migrant workers' housing and condition, the testing that our public health team is doing. When did we begin that? And the other question I would have through the mayor to you, Dr. Richardson, is so migrant farm worker housing conditions and health needs have been an invisible reality in this region for a long time. And there has been a long time call by those who've been working with migrant farm workers to have these issues addressed by the federal government, given the federal program that it's regulated by. But do farm workers also then receive care? Because my understanding from the migrant farm workers program is that they don't have access to our public systems.
Doctor?
Through you, Mr. Mayor, perhaps I'll just start out and then Michelle or Kevin could add some additional details. So yes, the Migrant Farm Workers Program, we work with them and we work with them on a regular basis to do environmental inspections of migrant farm worker housing. So we are in contact with them doing work from that perspective. Often for these groups, they are supported by community health centers. So we know that that happens in different parts of the province through different CHCs. I know in the particular outbreaks that have gone on in Haldeman, Norfolk, the family health team there has also stepped up in a huge way to support them. And so that is a challenge in terms of going forward, but there are some supports that are there. For the testing, we've been fortunate. Tim O'Shea has been working on testing in the shelter program. He's a great social medicine physician, as we all know. And our public health nurses have been working with him to do the testing. So he was able to get enough funding for the congregate setting testing that he could extend it into the migrant farm worker group. So they're just looking at how to do that from a risk perspective and how to move forward. And Michelle, I'm going to turn to you just to add any comments and whether exactly when that testing is going to start.
Thanks. So with respect to that testing, they should be starting, I would say, either late this week, but most optimistic, so probably early next week. They are trying to figure out the logistics, of course, are a bit different than the logistics in the shelter system, and trying to right now in a planning place with, it'll be with our staff going on site as well as some staff from Dr. Tim O'Shea's team, and trying to engage both the farm owners and the farmers as well as the migrant workers, and to basically build an awareness and desire to have the testing occur, because There are lots of barriers that are in place among this population, particularly around stigma and understanding the importance of why the testing would happen and what the outcomes are afterwards. So that piece of work will get underway, and then it's a process by which they'll actually be their swabs that the migrant farmers themselves will collect on their own. So it's a nose throat swab that would start up, and we'll get that as part of a routine surveillance project. As in Hamilton, our farmers, although there are farmers on site now, of course, the greater population of our migrant farmers arrive toward the end of the summer into the fall as we come into a harvest season. So we would want this well established as we get into that later part of the season.
Thank you. Councillor
Thank
Nan?
you. I appreciate the answer. So in terms of data collection then around migrant farm workers, that would just roll back into the data collection. Dr. Richardson, you had mentioned in terms of being able to disaggregate certain classifications or identity groups, or I guess in terms of the migrant farm workers, we'll have a sense of how many migrant farm workers tested positive since we began doing the testing.
Through you, Mr. Mayor, because we're doing it through a special program, we'll definitely get data that comes through that route. And then we will, if there are any positive cases, we will have data on the cases that are positive. Unfortunately, talking to our colleagues down Windsor Way, they have had positivity rates that are 9-13%. And I'm not, they have tremendous outbreaks as well that have happened, but we're hoping, we don't see anything like that in terms of our connections that we're having on an ongoing basis. And that's exactly what we're trying to prevent. But as Michelle said, it's a difficult environment for the workers and for the employers in terms of the importance of the work they do and understanding and feeling supported. And so it will be an important one to continue to follow and make sure we're doing well at.
Thank you.
Thank you. Through the Mayor, Dr. Richardson, I'll be very proud to help spread the word that this is something that our public health team is doing in partnership with Dr. Tim O'Shea's team. I think that this is an example of the type of innovation and response that's required. And back to your point earlier about remaining flexible yet responsive to where the needs are, I think that this is a critical example of public health doing what it can in moments of crisis for those who have been made more systemically marginalized, and yet are the workers that we rely on, because these are the folks that are producing the food in the region, and these are the folks who are working to make sure that the food is getting out of the crops and into our grocery stores. So I really appreciate that. On the disaggregated data points, when did we begin doing that collection?
Through you, Mr. Mayor, I believe it's 3 weeks ago now. I must tell you, time kind of melds all the way through now. But Michelle, 3 weeks, is it at this point?
Yes, I feel the same, that it's probably about 3 to 4 weeks at this point. I would have said it was more recently, but when I think about it, yes, probably 3 to 4 weeks. So we are starting to get data collected at this point in time.
Thank you. And through the Mayor, so it's my understanding that that data is currently from that point of initiation onwards. It's not from that point backwards towards all the cases that we've had.
Correct.
Through you.
Through you, Mr. Mayor. Correct. It's on a go-forward basis from the point at which we started. It wasn't possible for us to go back without having to contact all of those individuals. So it's a go-forward.
I can imagine the effort that that would take in terms of the recontact, but at the same time, I still sit with, I guess, a lot of, if there's anything that has become clearer and clearer over the course of this pandemic, is just how critical that data becomes in terms of measuring not only our baselines, but also getting a real sense of the realities of impact for this pandemic, but also generally speaking around every and all health conditions. And so when we have that information, we're able to plan and adjust our strategies moving forward, and rather than seeing some realities as being made invisible. On that front, I was just wondering, is there clarity? I had read a CBC article that referenced, CBC Hamilton article that referenced that our positive caseload broke down as a quarter of those who tested positive being frontline workers. Is there clarity on that from public health?
So through you, Mr. Mayor, just one thing of note, and I don't disagree with you about the desire to go backwards with the information when the province, we're anticipating a change that will allow us to collect data, not just for COVID-19, but for all diseases as we go forward, which would also be very welcome as we do this. So in terms of a quarter of our cases being frontline healthcare workers in particular, that doesn't take into account the other essential workers that were working in grocery stores or doing takeout or other settings, but a quarter of our cases had been frontline healthcare workers.
Okay. Thank you. I appreciate that clarity. That's it for my comments and questions at this point. I appreciate the report.
Thank you. Councillor Marula.
Thank you, Mr. Mayor. And just quickly through you to Dr. Richardson. Clearly, since we integrated the bylaw with respect to the social, it's important that we recognize that time that we understood that it was the only remedy available to us because of the uncertainty, and that masks are now being recommended only if you can social distance, which is actually a SAGE initiative. But one thing, in speaking with my family in my other hometown in Nice, France, they're saying that they're doing a lot of temperature checking as people are entering stores. And I'm wondering, have you heard anything along those lines of it being integrated in any way?
Doctor?
Through you, Mr. Mayor, not at this point. Temperature checking can be a bit tricky and expensive to do, quite frankly. So at this point, it's not being included. We always come back to that hierarchy of controls as well, right? The physical distancing is the main thing, limiting the number of contacts, staying home if you're sick. And then the situational masking is important. So Michelle, I don't know if you've seen anything more recently, but I haven't seen anything from our folks in Ontario or Canada more broadly beginning to look at temperature checks for settings like business and that sort of thing. They're certainly being deployed in airports. They're being deployed in healthcare settings in terms of screening, but not in sort of general screening.
Okay. Sorry, Michelle.
No, I haven't seen anything beyond that.
Okay.
Okay. And the reason why I say that is because in another article I read in the Toronto Star, I believe it was, they found that customers, actually with CTV, that are most likely to return to the shopping if stores have integrated very safe social distancing enforcement measures, as well as sanitizing, as well as temperature checking as well. Internationally, they're saying that. Globally, those are the three most important aspects of allowing people to feel comfortable to access a store, which begs the question, is that going to be the case for city facilities and recreation facilities or public health, everything we offer as a service? So are we going to be integrating everything we offer everything we offer as a service, are we going to be integrating these measures as well that to coincide with the retail sector in Canada?
Through you, Mr. Mayor, absolutely. In terms of many of the measures that you discussed, we talked about how we've put in those physical barriers. We look at the wayfinding type signage so that people are able to keep their distance as they go through. The situational masking that's encouraged, whether it's on transit or any place where people aren't able to maintain that distance. Temperature checking, as I said, we don't yet see that as one that we're going to add to our suite. We've got good control with what we've got, and there is always the balance about how much are we going to spend in one direction versus another. And so we're waiting to see that evidence and see what other people bring together on this one. But the mainstays have to be there. We have to, what I'm most worried about, and I think is what some of what we saw just before we were able to move to stage 2 was some people getting a little bit more lax, shall I say, and wanting to go back to normal. People thinking that this would be over and we could just go back and not worry about things, and it's not. And we saw what happens when people do start to let down their guard a little bit too much. The numbers went back up in that particular age group, and so it is so important that we continue to maintain those measures.
Thank you.
Okay. And I guess the elephant in the room right now will be the second wave. Now, I'm hearing that it's inevitable. Um, is that a fair statement that inevitably we will be receiving or getting a second wave?
Through you, Mr. Mayor, I think what's inevitable is we're going to be living with this for some time, and it's going to be up to all of us and what we do in order to help determine how much of a second wave there is or doesn't happen, and how it interacts when other viruses come into play. You know, when we start to have influenza again and those sorts of things, we'll start to see. We know that for some organisms there is some synergy that happens, that they can come together and make people sicker. And certainly we hope that's not the case here. We don't have any evidence that that's the case here, but we're going to be reacting and managing something that's new for us this year as we go forward.
Thank you.
Okay. And lastly, Mr. Mayor, with respect to the new normal and issues such as concert venues and football stadiums and soccer stadiums and baseball, do we have any idea, like the third, what does the third stage look like is my question.
Doctor?
Through you, Mr. Mayor, if there's one thing I miss almost as much as the Ticats, going to watch Ticats is going to watch concerts at the Tim Hortons Field. So I can, it's certainly something I watch very closely in terms of where we go forward. And so, you know, I think we really are going to continue to learn from our experience as to how things go and what we're able to do. We're going to continue to track the numbers that you've seen, those performance metrics, and the provinces doing those as well, to see what happens as we move forward. Absolutely, you'll see that there's, with going into stage 2, there's small sort of animal show type venues. I think of small, I don't want to say fairs because that's not quite right, but small things that are the beginning of those scale of the larger things. We start to see teams to be able to train. And so I think what we will see with phase 3 is how much bigger can we go? Do we need to keep going in steps? Do we need to put some more reminders in place? What can we do as we go forward? But you know, I'm really encouraged by places like New Zealand who've pretty much managed to eliminate it, where they've had really good case and contact management, really good testing, really good outbreak control, where you can reduce the numbers significantly. And so that's where, you know, I do come back to the fact that somebody who goes and gets tested for COVID-19 and is positive, what are we doing for them to thank them for that, and to thank them for the time that they are in isolation, that their contacts are put in isolation, because they're doing it for all of us. The benefit for them, you know, isn't sort of there. And so we need to make sure that we're continuing to recognize the good work that has been done by people to stop the spread.
And
We're beyond 5 minutes now.
Okay,
so
sorry.
Everybody else.
I can come back
back
later.
on, or is he going to wrap it up?
I just wanted to commend Tom Jackson, because I think his line of questioning with respect to people minimizing the severity of it, this whole hoax theory, conspiracy nonsense, is real. And I think we need to talk about that later in a communications type of way of dealing with it. I'm getting it everywhere, and it's frustrating to me, to be quite frank with you. So I think Tom hit a really important point that we need to work on. So I appreciate your time. Thank you.
Fair enough. Thank you. Councillor Wilson?
My questions have been asked and answered. Thank you.
Brilliant. Thank you. Councillor Farr?
Thank you, Mr. Mayor. And yeah, a few of mine have also been asked and answered, so I'm sure we'll keep it within the 5. I wanted to focus specifically on the one area, York and Bay. Anybody who's traveled through that area obviously have a burned impression of late on their minds, and I certainly heard from a large number of people in and outside the ward with respect to what's happening there. So we have still the porta potties up. This is York and Bay, for those who are unaware, outside the First Ontario Centre, where we rightly set up a very large, perhaps Canada's largest men's shelter during this pandemic, and set a standard, I'm sure, across this nation in looking after our most vulnerable in this community. We have the porta potty units now being professionally cleaned and disinfected. I believe it's 3 or 4 times a week by the contractor. We have our PW staff cleaning up the area every morning. And we put more garbage receptacles in there. Good Shepherd are operating the First Ontario Centre men's shelter. I think they have about 70 in there now, and they've begun to patrol the area in the morning and the afternoon, and are working on social distancing guidance and good governance in that area. And I can see over the course of the last couple of days that has helped us. We are supported by our street outreach, of course, social navigator through Hamilton Police Services and EMS, actively linking individuals to supports in the community, and even housing some of the individuals that are gathering day and night throughout the overnight outside First Ontario Centre. And our housing staff have been very helpful too. Now, I'm by every morning and every evening, and watching this evolve, obviously trying to respond to the constituency. And it's a potpourri, Dr. Richardson. It's everything from, you know, the senior who wants to go to the market who feels intimidated at the number of, unfortunately, vulnerable, homeless, mostly men, but not all, that are putting some in our community in fear of taking that path. Others on the other side of the spectrum who see what's happening there, with the, you know, some of the issues with the porta potties and the debris on the street and the drug use that's very visible at all hours. And they want us to help more than we are. Now, I've just went down the list on different divisions, and there's more people assisting, especially from our service community. I'm wondering what public health is doing in response to what we've never seen before, such a concentration on York Street and Bay Street on the outside of First Ontario Centre. I'm wondering specifically, I know we talked about some mental health and street outreach in your presentation, and I appreciate it. But we have folks with varying concerns, and certainly this is a public health issue in many respects.
So Paul Johnson's on the call, and I think Dr. Richardson's on it. So Doctor,
I'm interested, Mr. Mayor, in absolutely hearing from Paul too, but I would like, from a public health perspective, if Dr. Richardson is sending staff and what their role is.
Thank you.
Through you, Mr. Mayor. So in terms of mental health and street outreach, absolutely, our staff have continued to work with people who are on the street and connect them as we can with care, connect them in terms of their needs, and do that work. And of course, we've been supporting the shelter from a public health perspective as well as it's gone forward. Michelle, I don't know if there's more you can speak to in terms of that particular venue and what the MHSO team might have been doing, or Bonnie, if you do. Around that particular team, but otherwise I would turn it back to Paul.
Okay, Bonnie or Michelle?
So through you, Mr. Mayor, from our perspective, yes, the MHSO team, the street outreach team, certainly has been involved at that location. In addition to that, we're aware of the needle debris in the area, Councillor, and so a needle disposal bin was installed there with hopes that that would take some of the burden off. And there is needle exchange. The van is making frequent and usual stops to the facility as well, and that's been happening consistently.
Thank you.
What about, Mr. Mayor? So why is there some sleeping rough right outside a shelter that has essentially 100 and change beds and still many beds available, space available? Do we know, do we speak to some of those folks and ask what's the reasoning behind preferring to sleep rough right outside the doors of a shelter that offers the meals, that offers the clothing, the showers, the facilities that one would need right on the other side of the glass doors? Do we know why sleeping rough is happening? And sometimes it's rate increases and then goes down, then goes up again, but roughly there's 12 to 20 people sleeping rough.
Okay. Paul Johnson, do you have any insight on that? I mean, Pete Weismer would have some interesting insight on that. Officer Pete Weismer, who spends an awful lot of time there trying to get people into housing and off the street and into care. But Paul Johnson?
So through you, Mr. Mayor, I don't have the answers to that. I have a historical knowledge of seeing exactly the same thing when I worked at Wesley Urban Ministries, and we actually ran an overnight shelter, a drop-in center and shelter, and the same thing. People very close to shelter don't feel comfortable with it. Sometimes there are issues about being able to stay together in terms of we do put people into men's shelters, women's shelters, youth shelters, family shelters. So sometimes the ability to stay together as a unit is a bit of an issue as well. And the other reality is we can't force people to go into shelters. So there are multiple levels of realities here, and I think what we're trying to bring forward on Friday as a beginning to this is we need to start to build the system that's going to work for Hamilton through the rest of this pandemic as we live with the new reality of COVID in our community. What you're seeing now is the emergency responses. We simply had to very quickly decant. We had to very quickly pivot to the realities of not having malls open, not having places where people could access washrooms, but we're on a path, I think, as the city to do some things that will provide the right kinds of options. But in terms of all the reasons why people might not still choose to access those, even when more things are in place, there are as many answers to that as there are the questions of why people might choose to do that.
And probably as many questions, Mr. Mayor, as there are answers as to why our most vulnerable population, quite obviously, is challenged in some respects on the physical distancing. And I know it's not for lack of trying from everyone under Paul's purview and Dr. Richardson and everyone else. It's something that folks generally want to communicate to their counselor with here in Ward 2. So I appreciate those answers. And Dr. Richardson, on a positive note, I do appreciate the angle you've taken since or the line you're promoting since the phase 2 was announced on Monday, that we have been warming up for this for several months. We're ready to get in the game, and we're going to do all those responsible things. And we've had that practice, as you say, and I have all the faith that 99.8% of our community is going to put that practice to the test as we enter into phase 2 on Friday. Thanks, Mr. Mayor.
Thank you. Councillor Jackson, second time.
Thanks, Mr. Mayor. Last two questions. Dr. Richardson, in an industry, the hospitality restaurant industry that I've spoken to from time to time at council meetings, and virtually wanted to put my arms around them to let them know that people care about them because of the anguish of what they're going through. Many that worried that they may not be able to reopen and resurrect their businesses, and hoping that most of them, lion's share of them, will be able to. So in light of phase 2, Hamilton now, province saying we're underway, Dr. Richardson, just wonder, and of course, health is still paramount, but I'm just hoping and wondering, how are your inspectors going to approach the patios, the restaurant opening, gradual openings? They've done many of them. I've been my family and I, friends have been supporting the ones that have been doing simply takeout and pickup over the last 3-4 months. But now with the small business industry, employs thousands, pays taxes. Many of the workforce are of a female workforce, of course, with the minimum wage they get and the tips that help them to try to make a decent income. Just wondering, Dr. Richardson, how we're going to approach that, as many of these businesses are hoping to survive and reemerge again. Through you, Mr. Mayor, please.
Thank you.
Through you, Mr. Mayor. Yes, a lot of empathy for these businesses, and a number of them did a yeoman's work to turn it around and start doing takeout. After a few weeks, some of them took as they tried to suss up what would work for them. Lots of sympathy for this group. My son's a part of that industry, and he was starting a new job on the day they closed down restaurants. So he's been out of work that whole time. So with our inspectors, we are going forward in terms of doing our routine inspections. As you heard me talk about earlier, we do need to get back to doing our usual food premise inspections with a COVID twist as we go forward in terms of observing social distance or physical distancing and those sorts of things. But we've also published guidelines for them, which should be up on the web as of yesterday. There is general provincial guidelines around workplaces, but we did up some more specific guidelines. The public health units across Ontario have been working on those. Toronto's done a lot of work on them so that they could have some more specific guidance. So our approach is very much supportive in terms of helping these people know what they can do to move forward. Of course, we do consider the food service industry a bit of our particular responsibility in terms of making sure that they're supported and aware of what they need to do. So we did, as a public health service across the province look to support them more so with some specific guidance that we thought wasn't there. So we'll be working with them. We'll be answering questions for them as they get back up and running, and then continuing to do, as I said, our usual inspection program of inspecting 3 times a year.
Thank you.
That's great, Doctor. You raised my comfort level with that. That's encouraging. Hopefully many small business owners are listening to that. Sounds like a nice diplomatic approach. And lastly, Dr. Richardson, a number of people I know with loved ones in hospital waiting for a direct discharge to an LTC. Hospital staff have said their hands are tied. Through your network with the province, when do you hope that the province will allow stage 3 to occur, that will allow discharge from hospitals for loved ones into LTCs? What's your network telling you? And that's my last question, Mr. Mayor. Thank you.
Through you, Mr. Mayor. So the Directive 3, which is the one that allows or disallows admissions from hospital, has been changed, and so we are looking at having that. We're working out the kinks in people understanding what they still need to do when people are transferred in terms of negative results or continue to isolate for 14 days. We're working all of that through, and there's some of those questions that are still getting answered and massaged. But with that should be moving forward now as we sort out those details. Michelle, have I got that right?
Yes, you do.
Anything else in terms of the challenges going forward with it?
No, I think that's it.
So, Dr. Richardson, just in recent conversations with some hospital staff, they led me to, and when I say recent, in the last 72, 96 hours, they still led me to believe they were handcuffed in terms of allowing discharge. So maybe has that changed in the last 3-4 days?
Through you, Mr. Mayor, it's Michelle. There are some challenges with respect to discharge into long-term care, and no, it hasn't been resolved, but I can say that the system as a whole is certainly trying to work through it. It's not specific to Hamilton. It's been a system-wide issue.
Okay. Thank you, Director Baird. Thanks, Mr. Mayor.
Okay, thank you. Councillor Wilson.
Yep, thanks, Mr. Mayor. Councillor Farr's question just prompted something I've been thinking about for some time, and I wanted to take the opportunity to speak with Dr. Richardson about it in terms of a go-forward plan. So it's been established today that this virus is going to be with us for some time. And I think it's fair to say that even upon a vaccine, the imprint of it will probably last forever. Councillor Farr brought up the question of public washrooms, and I think Mr. Johnson reported with the closure of malls and other third spaces, this has created a crisis, so to speak, for people who don't have access to either permanent safe shelter and therefore by extension bathrooms or income to get into places where you have to pay and then use the washroom. I'm interested, I know the city of Edmonton is doing a study on public washrooms and how over the last 30 years we have retreated from providing public washrooms and treating it as public infrastructure. At what point in this journey do we start looking and talking about the lessons that this pandemic has offered us in terms of city building? Public washrooms being a one case in point, Dr. Richardson?
Through you, Mr. Mayor, I think, there's many opportunities and issues that arise out of dealing with this pandemic across, just about every scope of care and service delivery. And as we move forward, we have to look at those and decide which of those are going to be the priority ones that we're going to move forward with. The issue of public washrooms has been on and off the table my entire public health career in terms of how they're managed, not just here in Hamilton. I mean, on a much broader basis than that. And so, I think that's one of the things for us to consider as we go forward is that, one of the issues we know we need to tackle supportive housing. We know we need to tackle residential care facilities. We know the province is going to need to tackle long-term care retirement homes. I think it's going to come down to making a decision about which are the key priority issues that we're going to tackle.
And reflecting those in our budgets as well then. Thank you. Thank you very much for all your work.
Okay, thank you. I see no further speakers. And again, Doctor, thanks to everyone for the ongoing work, and the work continues, and there'll be lots of lessons learned from this this process that I'm sure we'll have implementation strategies built around them as we go forward. Could I have a mover and a seconder on the presentation? Moved by Pearson, seconded by JP Danko. All in favor of receiving the presentation, please go to a vote. It will pop up in a moment. And thank you for that. And then there's a motion on the report itself. Could I have a mover and a seconder on the report? Moved by Nan, seconded by Councillor Vanderbeek. Any other questions? If not, we'll go to a vote on that as well. Came up quickly. Very good. Thank you. Councillor Clark, didn't see a vote come through for you visually. Thumbs up for Councillor Clark. Okay, thank you. All righty, thank you. And then we're going to go to the general information and other business sector amendments to the outstanding business list. So there are a number of due date and changes. Are there any comments and questions on it? No? Okay, thank you. Sorry? Okay, I didn't see one on the speakers list. So do we need a motion on the outstanding business list? Okay, can I have a mover and a seconder on that? Moved by Councillor Partridge, seconded by Councillor Clark. All in favor? Again, electronic vote on that. Coming up shortly or quickly, almost promptly. There we go. And those are all the items we're dealing with. So thank you all very much for your presence, your participation, and a motion to adjourn would be appropriate. Moved by Councillor Nunn, second by Councillor Pearson. All in favor? Show of hands, I think, works. Thank you all very much. Nope, show of hands doesn't work. Sorry, apologies. One more time. God, I just want to get back to that show of hands processor. The ayes have it. But now the votes have it. Submit. And got everybody? We've got enough. So all carried. Thank you very much. Thank you. Great meeting. And we'll talk to you soon. Have a great day. Bye-bye.